Hello scholars, my name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click the subscribe button and don't forget to like the video. That way I can keep producing the videos that you like best. Now in the last video, we took a look at conversion disorder, and in this video, we're going to cover factitious disorder. So let's begin. Can you imagine telling people you have a broken foot even when you didn't? Can you imagine taking medication for a disorder that you know that you don't have? What about feeding yourself dog feces to get yourself so sick that you can stay in a hospital? There are individuals that do this, and this disorder is known as factitious disorder. Now, in order to be diagnosed with factitious disorder, a person has to have the following symptoms, which are listed in the DSM-5. A, the individual will state they have physical or psychological symptoms or are injured from a disease with the purpose of lying or deceiving others. B, when the person presents themselves, they will state that they are sick, disabled, or injured. C, the individual will falsify their condition even when they're not being rewarded or getting extra care for being sick or injured. And then D, the person does not have another medical condition like delusion disorder or another mental illness that takes into consideration what they are presenting with. Now, a clinician will want to specify if this is the first time that an individual is attempting to falsify an illness or injury, or if they have multiple episodes of trying to do this. Now, what is extremely interesting about this mental illness is that there is another factor to it. Factitious disorder can be falsified by somebody, an individual, about another individual, such as a spouse, such as a child, or even their pet. So what this means is that a parent could be lying about their child having cancer. They could be providing their child or their spouse with medication that they do not need. They could also be feeding their child or spouse or pet foods that are not prepared properly for the purpose of making them sick. Yeah, this is also known as factitious disorder by proxy. So, according to the DSM-5, factitious disorder by proxy has the following symptoms. A, an individual falsifies psychological or physical symptoms or symptoms given another person for the purpose of deceiving others. B, the person will present another person as impaired, sick, or injured. C, an individual will continue falsifying information about another person even when they're not rewarded by society for this information. D, the person's falsification cannot be better understood by another mental disorder, such as delusional disorder or any type of psychotic disorder. So in this scenario, the perpetrator of the falsification would receive the diagnosis. That's very different from our other mental illnesses. The clinician will want to specify if this has been done only one time or multiple times. This will be noted as factitious disorder imposed on another, such as an adult, a child, or a pet. They may also be seen as abuse toward that other person. Now, with this diagnosis, it needs to be shown that the individual is purposely simulating, misrepresenting, or showing signs of an illness or injury, even in the absence of social or external rewards. If an individual fabricates, exaggerates, or simulates an illness or injury, this can be considered part of that disorder. When it has been found out that the person has been fabricating illness or injury, the outside world does tend to view that person as more mentally ill and in need of help. Examples of factitious disorder may include like stating that you have depression because somebody in your family died, like a spouse or a daughter, and then you don't actually have a spouse or a daughter. An individual may report having neurological symptoms that are not there, saying that they're passing out all the time or having dizziness or having seizures. Some individuals may go to the extent of trying to add blood to their urine in a test conducted at the hospital, and even to the point of injecting yourself with insulin so that tests come out abnormal at the clinic or at the hospital. Individuals have been known to eat something with mold on it or that is not cooked properly that they know will make them sick. Now, even though the intended purpose of factitious disorder may be to gain attention or care from others, there's a host of reasons. Clinicians are not supposed to focus on the why. It's just the fact that they made it up or exaggerated it that needs to have the focus be on that part of it. Not only are the individuals making that up impacted, but medical staff that go through those issues with persons, family members, and their friends are psychologically affected from this lying, essentially. Factitious disorder can be very dangerous because just like substance abuse disorder or eating disorders, the behavior is not easily corrected. People with factitious disorder like to continue deceiving others. Sometimes the behavior can lead to a criminal charge, especially if someone is making others sick. It's important when diagnosing factitious disorder not to be concerned about the intention of the falsification, but to get it correctly diagnosed. The deception is what needs to be uncovered in order to make that first step toward any type of recovery. Now, about 1% of the population in the United States has factitious disorder. For those individuals that have this disorder, it's very rare for there to be one episode of it. Usually the disorder will begin in childhood and often after a hospitalization event, such as like a car accident or a bad sickness. When an individual imposes a false sickness onto someone else, this tends to happen after a hospitalization of that other person as well. They might have seen, the type of care or attention that possibly brings on. But again, we're not supposed to focus on that. Eventually, this becomes a cyclical process in which people seek out care from others and hospitalizations on a regular basis. And a singular episode is very, very rare. Given these issues at hospitals and clinics, it's really important that this person or the person that is trying to falsify medical conditions, that they be found with that. The recovery is definitely psychological, if not prison, if they are creating some sort of child abuse or issue that is coming up with that. All right, well, that is the end of the video. You can definitely find a host of examples online where people have falsified their own disorders, but I think more kind of shocking is the stories in which they proxy an illness onto somebody else, and you can find those on YouTube as well. I hope you like the video. Thank you so much for being a part of this channel. It is so much appreciated. Have an amazing day, and I will talk with you soon.